Every single day, 68 million Americans walk into a pharmacy or open a supplement bottle and swallow a magnesium capsule. They read an article, heard a podcast, maybe watched a video just like this one. They believe they're doing something healthy, and in 40 to 60% of cases, they're absolutely right. But in the remaining cases, something very different is happening. Their kidneys are struggling, their heart rhythm is being disrupted, and their blood pressure is dropping to dangerous levels while they sleep. Not because magnesium is bad, but because nobody told them the 6 critical warnings that determine whether this mineral becomes medicine or poison in their particular body. I need to be direct with you. Magnesium is not a harmless supplement you can take casually because a wellness influencer recommended it. It is an electrolyte that controls over 300 enzymatic reactions in your body. When those reactions go wrong, the consequences are measured in emergency room visits. And here's what makes this situation particularly dangerous. The people who need magnesium most desperately often show no obvious symptoms, while the people who should never touch it often feel perfectly fine until suddenly they don't. Subscribe to Dr. Waterling right now and hit that like button. We're building this channel on one principle, telling you what actually happens inside your body, not what the supplement industry wants you to believe sells products. Every subscriber moves us closer to 1,000, and every video we make challenges the system that profits when you stay confused, not when you get clear answers. The healthcare industry does not profit from you understanding which supplements you actually need and which ones you should avoid. There is no revenue in prevention. Your next doctor's appointment will not include a 30-minute analysis of your magnesium status, your kidney function, and your medication interactions. There isn't time for it, and there isn't a billing code that pays for it. What I'm about to tell you comes from 15 years of clinical practice, watching patients make dangerous mistakes with supplements they believed were completely safe. Let me start with the 6 warning signs that mean you should not take magnesium, or at least not without very careful medical supervision and specific monitoring. Warning sign number 1. You have chronic kidney disease or your creatinine levels are elevated. Your kidneys are responsible for filtering excess magnesium out of your bloodstream. When kidney function declines below 50% of normal, magnesium begins accumulating in your blood because your body cannot eliminate it efficiently. This condition is called hypermagnesemia, and it is genuinely dangerous. The early symptoms are subtle: unusual tiredness, muscle weakness that feels different from normal fatigue, maybe some nausea. But as magnesium levels continue rising, you develop irregular heartbeat, severely low blood pressure, difficulty breathing, and eventually cardiac arrest. This is not theoretical. This happens. If your most recent lab work showed elevated creatinine, typically above 5 milligrams per deciliter, or if you've been told you have any stage of chronic kidney disease, you need medical clearance before taking magnesium supplements. You may still need magnesium, but the dosage must be carefully calculated based on your exact level of kidney function, and your blood levels need regular monitoring. Warning sign number 2, you're taking certain prescription medications that interact dangerously with magnesium. The most critical category is bisphosphonates, medications prescribed for osteoporosis, with names like alendronate, risdronate, or ibandronate. Magnesium binds to these medications in your digestive tract and blocks their absorption completely. You take your osteoporosis medication believing it's protecting your bones, but if you're also taking magnesium within 4 hours, you're getting almost no therapeutic benefit. The second category is certain antibiotics, particularly tetracyclines and fluoroquinolones. Magnesium forms complexes with these antibiotics that your body cannot absorb, meaning you're taking medication for an infection that isn't reaching therapeutic levels in your bloodstream. The infection continues while you believe you're treating it. The third category is certain blood pressure medications, especially calcium channel blockers. Magnesium enhances their effect, which sounds beneficial until your blood pressure drops so low you experience dizziness, fainting, or dangerous falls. If you're taking any prescription medications, you need to verify compatibility before adding magnesium. This is not optional caution. This is genuine drug interaction risk. Warning sign number 3, you have a cardiac conduction disorder or you're being treated for irregular heartbeat. Magnesium directly affects the electrical system of your heart. In normal hearts with normal magnesium levels, this effect is stabilizing and protective. But if you have a condition called heart block, where electrical signals are already delayed as they travel through your heart's conduction system, adding supplemental magnesium can slow conduction further and create dangerous rhythm disturbances. The same applies if you have severe bradycardia, meaning your resting heart rate is consistently below 50 beats per minute. Magnesium can push it even lower, potentially to levels that cause dizziness, fainting, or inadequate blood flow to vital organs. If you have any diagnosed cardiac conduction disorder, if you've been told you have heart block of any degree, or if you have a pacemaker, magnesium supplementation requires cardiology clearance with specific dosing guidance. Warning sign number 4, you have myasthenia gravis or any neuromuscular disorder affecting muscle strength. Magnesium reduces the release of acetylcholine at neuromuscular junctions. In simple terms, it makes it slightly harder for nerves to activate muscles. In healthy people, this effect is negligible and unnoticeable. But in people with myasthenia gravis, a condition where neuromuscular transmission is already impaired, additional magnesium can trigger or worsen muscle weakness, difficulty swallowing, breathing problems, and even myasthenic crisis, requiring emergency intervention. This is one of the clearest contraindications in medicine. If you have been diagnosed with myasthenia gravis or any related neuromuscular disorder, you should not take magnesium supplements without explicit approval from your neurologist. Warning sign number 5, you're experiencing persistent diarrhea or you have inflammatory bowel disease in an active flare. Magnesium is famous for its laxative effect. Milk of magnesia, magnesium citrate used for bowel prep before colonoscopy. These work precisely because magnesium draws water into your intestines and stimulates bowel movements. If your digestive system is already inflamed, if you're experiencing frequent diarrhea from Crohn's disease, ulcerative colitis, or even temporary gastroenteritis, adding magnesium will worsen the diarrhea significantly. This creates a vicious cycle. Diarrhea causes electrolyte loss, including magnesium. You take magnesium to replace it. The magnesium worsens the diarrhea, and you lose even more electrolytes. During active digestive inflammation or persistent diarrhea, intravenous magnesium replacement may be necessary, but oral supplementation usually makes the situation worse. Warning sign number 6, you have severely low blood pressure or you frequently experience dizziness when standing up. Magnesium has a mild blood pressure lowering effect, which is beneficial for people with hypertension, but potentially dangerous for people whose blood pressure is already low. If your blood pressure consistently measures below 90/60, or if you experience orthostatic hypotension, meaning your blood pressure drops significantly when you stand up causing dizziness or lightheadedness, magnesium supplementation can push your pressure even lower and increase fall risk, particularly in older adults. Those are the 6 critical warnings. If any of them apply to you, you need medical evaluation before taking magnesium. You may still need it, you may still benefit from it, but it requires professional supervision, careful dosing, and often regular monitoring. Now let's talk about the 12 signs that indicate you absolutely must take magnesium daily because your body is screaming for it and you're either ignoring the signals or you don't know how to interpret them. Sign number 1, you experience regular muscle cramps, particularly at night. That sudden vicious contraction in your calf muscle at 2 in the morning that makes you leap out of bed, that's often magnesium deficiency announcing itself. Magnesium regulates calcium entry into muscle cells. When magnesium is insufficient, calcium floods in uncontrollably, causing sustained contraction, the cramp. This is especially common in the calves, feet, and hands. If you're experiencing muscle cramps more than twice a week, particularly if they wake you from sleep, magnesium deficiency is the first thing that needs investigation. Sign number 2, you have persistent eyelid twitching or facial muscle spasms. That annoying little flutter in your eyelid that comes and goes for days or weeks, that's fasciculation, involuntary muscle fiber contraction. While it can have neurological causes, in otherwise healthy people, it's most commonly caused by magnesium deficiency combined with stress and fatigue. The muscles around your eyes are particularly sensitive to electrolyte imbalance because they're under constant fine motor control. Sign number 3, you struggle with chronic constipation despite adequate fiber and water intake. Magnesium is essential for intestinal muscle contraction, the peristaltic waves that move contents through your digestive tract. When magnesium is deficient, intestinal motility slows, transit time increases, and constipation develops. If you're eating vegetables, drinking water, maybe taking fiber supplements, and you're still only having bowel movements every 3 or 4 days, requiring significant straining, magnesium deficiency is likely contributing. Sign number 4, you have diagnosed high blood pressure or prehypertension. Magnesium helps regulate vascular tone, the degree of tension in your blood vessel walls. When magnesium is adequate, blood vessels maintain appropriate flexibility. When it's deficient, vessels become overly constricted, resistance increases, and blood pressure rises. Multiple meta-analyses have confirmed that magnesium supplementation produces modest but clinically meaningful blood pressure reduction, typically 3 to 5 millimeters of mercury systolic and 2 to 3 millimeters diastolic. That might not sound dramatic, but it's significant enough to reduce cardiovascular risk, particularly when combined with dietary improvements and other lifestyle modifications. Sign number 5. You experience anxiety, irritability, or difficulty managing stress. Magnesium modulates the stress response system. It regulates cortisol production and affects neurotransmitter balance, particularly GABA, the primary calming neurotransmitter in your brain. When magnesium is insufficient, your stress response becomes hyperactive. Small stressors trigger disproportionate reactions. You feel on edge, irritable, unable to relax even when circumstances are objectively calm. Research published in the journal Nutrients demonstrated that magnesium supplementation significantly reduces subjective anxiety scores in people with mild to moderate anxiety, particularly when combined with vitamin B6. Sign number 6. You have difficulty falling asleep or you wake frequently during the night. Magnesium affects multiple sleep-regulating mechanisms. It activates the parasympathetic nervous system, the calming branch that prepares your body for rest. It regulates melatonin production and timing. And it binds to GABA receptors in the brain, promoting relaxation and reducing neural excitability. When magnesium is deficient, all these systems function suboptimally. You lie awake with racing thoughts, or you fall asleep but wake at 2 or 3 a.m. unable to return to sleep. If you're experiencing sleep disturbance more than 3 nights per week, magnesium status deserves investigation. Sign number 7. You consume a standard Western diet high in processed foods and low in vegetables and whole grains. Here's a nutritional reality most people don't realize. Magnesium comes primarily from dark leafy greens, nuts, seeds, legumes, and whole grains. Spinach, Swiss chard, pumpkin seeds, almonds, black beans, brown rice. If those foods are not regular components of your diet, if your meals center around meat, dairy, bread, pasta, and processed snacks, you're almost certainly consuming inadequate magnesium. The average American diet provides roughly 250 milligrams of magnesium daily. The recommended intake is 400 to 420 milligrams for men and 310 to 320 milligrams for women. That gap represents chronic low-grade deficiency affecting millions of people. Sign number 8, you're over 60 years old. Magnesium absorption declines with age. The intestinal mechanisms that actively transport magnesium across your gut wall become less efficient. Simultaneously, kidney excretion of magnesium often increases. This creates a double impact. You absorb less from food and you lose more through urine. Additionally, older adults typically take more medications, many of which interfere with magnesium status. Proton pump inhibitors for acid reflux reduce magnesium absorption. Diuretics for blood pressure or heart failure increase magnesium excretion. If you're over 60, particularly if you're taking multiple medications, you almost certainly need magnesium supplementation. Sign number 9, you have type 2 diabetes or prediabetes. Magnesium is essential for insulin function. It's required for insulin secretion from pancreatic beta cells and for insulin receptor sensitivity in muscle and liver cells. When magnesium is deficient, both processes become impaired. Your pancreas struggles to release adequate insulin, and your cells become resistant to the insulin that is released. This creates a vicious cycle. Diabetes causes increased urinary magnesium loss. Magnesium deficiency worsens insulin resistance. Worsening diabetes causes even more magnesium loss. Multiple studies have demonstrated that magnesium supplementation improves insulin sensitivity and glycemic control in people with type 2 diabetes or metabolic syndrome. Sign number 10, you experience frequent migraine headaches. Magnesium deficiency is one of the most well-documented migraine triggers. People who suffer regular migraines have measurably lower magnesium levels than people without migraines, both in blood and in brain tissue. Magnesium helps regulate neurotransmitter release and prevents the cortical spreading depression that initiates migraine attacks. Clinical trials have shown that magnesium supplementation, particularly at doses of 400 to 600 milligrams daily, reduces migraine frequency by 40 to 50% in many patients. If you're experiencing migraines more than twice a month, magnesium should be part of your prevention protocol. Sign number 11, you exercise intensely or you sweat heavily on a regular basis. Magnesium is lost through sweat. If you're running, cycling, doing high-intensity interval training, working in hot environments, or simply sweating heavily due to climate or individual physiology, you're losing magnesium that needs replacement. Athletes and physically active people have measurably higher magnesium requirements than sedentary individuals. The combination of increased metabolic demand and sweat loss can create deficiency even in people eating relatively good diets. If you're exercising vigorously 4 or more times per week, magnesium supplementation is almost certainly beneficial. Sign number 12. You consume alcohol regularly or you have a history of heavy alcohol use. Alcohol has multiple negative effects on magnesium status. It increases urinary magnesium excretion. It damages intestinal cells, reducing absorption, and it interferes with vitamin D metabolism, which is necessary for proper magnesium utilization. If you drink alcohol daily, even at moderate levels, or if you have a history of heavy drinking, your magnesium status is likely compromised. This is one of the reasons why alcoholics are at high risk for cardiac arrhythmias and seizures during withdrawal. Severe magnesium depletion combined with alcohol's direct effects creates dangerous electrical instability. Those are the 12 signs indicating you need daily magnesium supplementation. If 3 or more apply to you, supplementation is almost certainly beneficial. If 6 or more apply, it's nearly mandatory. Now the practical section. Which form of magnesium, how much, and when should you take it? Magnesium supplements come in multiple forms with dramatically different absorption rates and effects. Magnesium oxide is cheap and widely available, but only about 4% of it is actually absorbed. You're essentially paying for magnesium that passes through your digestive system and into the toilet. Magnesium citrate is better absorbed, around 30%, and it has mild laxative effect, which is beneficial if you're using magnesium partly for constipation relief. Magnesium glycinate is the form I recommend most often because it's highly absorbable, around 40%, and it's the least likely to cause digestive upset or diarrhea. Magnesium threonate is specifically marketed for cognitive benefits and brain health because it crosses the blood-brain barrier more effectively than other forms, but it's expensive, and the clinical evidence is still developing. For general supplementation in adults, I recommend 300 to 400 milligrams of elemental magnesium daily, taken as magnesium glycinate. That's the amount of actual magnesium, not the total weight of the compound. Most supplements list both. Take it in the evening, 30 to 60 minutes before bed. This timing capitalizes on magnesium's calming effects to support sleep quality. If you're using magnesium partly for constipation relief, switch to magnesium citrate, same dosage, same timing. The citrate form will have stronger laxative effect. If you're addressing migraines specifically, you may need higher doses, 400 to 600 milligrams daily, but this should be done under medical supervision, particularly if you're also taking prescription migraine medications. Start with 200 milligrams for the first 3 days to assess tolerance. If you experience no digestive issues, increase to the full 300 to 400 milligram dose. If you develop loose stools or diarrhea, reduce the dose or switch to magnesium glycinate if you are using citrate. You should notice improvements in sleep quality and muscle cramps within the first week. Improvements in blood pressure, anxiety, and constipation typically take 2 to 3 weeks of consistent use. Migraine reduction may take 4 to 6 weeks to become apparent because you're changing brain chemistry gradually. Take magnesium at least 2 hours away from calcium supplements, iron supplements, or zinc supplements because these minerals compete for absorption. If you're taking thyroid medication, take it in the morning and take magnesium in the evening. If you're taking antibiotics in the tetracycline or fluoroquinolone families, take magnesium at least 4 hours before or after the antibiotic dose. Here is your practical protocol. Evening, 30 to 60 minutes before bed, take 300 to 400 milligrams of magnesium glycinate with a small amount of water. If you're taking multiple supplements or medications, organize them so magnesium is separated by at least 2 hours from calcium, iron, zinc, or any antibiotics. Within 1 week, you should notice easier time falling asleep, reduction in muscle cramps if you were experiencing them, and possibly softer bowel movements. Within 2 to 3 weeks, if you had elevated blood pressure, you should see modest reduction, typically 3 to 5 points systolic. If you were experiencing anxiety or stress reactivity, you should notice you're calmer and less easily triggered. Within 4 to 6 weeks, if you suffer migraines, you should see measurable reduction in frequency. If you experience persistent diarrhea, reduce the dose by half. If symptoms continue, switch to magnesium glycinate if you were using citrate. If you develop unusual muscle weakness, extreme fatigue, or irregular heartbeat, discontinue magnesium immediately and consult your physician. These symptoms could indicate magnesium accumulation if you have undiagnosed kidney dysfunction. Get blood work annually that includes kidney function testing, specifically creatinine and estimated glomerular filtration rate. This ensures your kidneys are clearing magnesium appropriately and supplementation remains safe. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers because it will directly shape what I cover in future videos. If this video helped you understand which supplements you actually need and which ones could be dangerous in your specific situation, send it to someone you care about, a parent, a friend, someone who might be taking supplements without understanding the risks or missing supplements they desperately need. You may have just given them information that prevents a serious medical complication or finally resolves a symptom they've been struggling with for years. Subscribe to Dr. Waterling and hit that notification bell. We're building a community of people who understand that health is not about following trends. It's about understanding your body and making informed decisions based on science, not marketing.